Stop what you are doing right now, because what I am about to share with you in the next few minutes could be the most important thing you hear this entire year. And I say that not to be dramatic. I say that because I have spent decades studying how the aging body responds to food at the cellular level. And what I have found about kidney health specifically after the age of 70 is something that most routine doctor visits never cover. Your kidneys are two fist-sized organs sitting just below your rib cage. And after the age of 70, they are already working at roughly 50 to 60% of the capacity they had when you were 40. That is not a disease. That is normal biological aging. But here is where it becomes dangerous. Most people over 70 are eating foods every single day. Foods they believe are perfectly healthy. Foods their doctors have never warned them about, that are silently accelerating that decline, pushing kidneys that are already working harder than they should be past the breaking point. A study published in the Clinical Journal of the American Society of Nephrology followed over 45,000 adults above the age of 65 for 10 years and found that dietary choices alone were responsible for accelerating kidney function decline in 1 out of every 3 seniors, independent of diabetes, independent of blood pressure, independent of any existing condition, 1 in 3. And the majority had no idea it was happening until significant damage was already done. Today I am going to walk you through 5 specific foods that are particularly dangerous for kidney health after 70. We are counting down from number 5 to number 1. And I promise you, number 2 on this list is something that almost every senior consumes multiple times a week, believing it is one of the healthiest choices they can make. Stay with me all the way to the end, because this information could protect your independence, your quality of life, and the life you still have ahead. But before we begin, leave a comment right now. Tell me your age and tell me, has your doctor ever specifically talked to you about protecting your kidneys through diet? I read every single comment on this channel, and your answers shape everything I cover next. Now let us get into it. Number 5 is processed deli meats. And I know what you are thinking, a turkey sandwich, a few slices of ham. What could possibly be dangerous about that? Here is what is actually happening inside your body when you regularly eat processed deli meats after 70. These products, bologna, salami, packaged turkey, ham, hot dogs, are preserved using sodium in quantities that are genuinely alarming for aging kidneys. A single 2-ounce serving of standard deli turkey can contain anywhere from 450 to 700 milligrams of sodium. The American Heart Association recommends no more than 1,500 milligrams of total daily sodium for adults over 65. 2 sandwiches puts you at or beyond that limit before you have eaten anything else that day. Now here is why sodium is specifically damaging for kidneys after 70. Your kidneys are responsible for filtering excess sodium out of your bloodstream. When sodium load is consistently high, the kidneys are forced into a state of chronic filtration stress. Think of your kidneys like a water filtration system in a building. When clean water runs through it, the filters last for years. But when you push heavily contaminated water through that same system every single day, those filters wear out in months. That is exactly what excessive sodium does to aging kidney tissue. Research published in the Journal of the American Medical Association found that high dietary sodium intake in adults over 65 was independently associated with a 36% faster rate of decline in glomerular filtration rate. That is the medical measurement of how efficiently your kidneys are actually filtering your blood, a 36% faster decline. That is the difference between kidneys that function adequately into your 80s and kidneys that require medical intervention years earlier than they should. But sodium is only part of the problem with processed deli meats. These products also contain phosphate additives, compounds added during processing to improve texture and extend shelf life. Unlike the naturally occurring phosphorus found in whole foods, which your body absorbs gradually and partially, these synthetic phosphate additives are absorbed at a rate of up to 90%, according to research from the National Kidney Foundation. After 70, kidneys that are already less efficient at regulating phosphorus levels are overwhelmed. Excess phosphorus in the bloodstream pulls calcium directly out of your bones, weakens arterial walls, and accelerates the exact kind of kidney tissue damage that leads to chronic kidney disease. The practical change here is straightforward. Replace deli meats with freshly cooked chicken breast, canned low-sodium tuna, or hard-boiled eggs for your sandwiches and quick meals. Season with herbs, lemon, and garlic rather than salt. Your kidneys will begin responding to that reduction in load within days. And if you want a synergy tip that directly supports kidney filtration, add a slice of watermelon or a small serving of cucumber to that meal. Both contain compounds that support kidney circulation and gentle natural diuresis without stressing the filtration system. Now let us move to number 4. And this one concerns me deeply because it is something that has been aggressively marketed as a health food for years, and millions of seniors have been misled by that marketing. Number 4 is bottled sports drinks and electrolyte beverages. Gatorade, Powerade, and similar products are everywhere. And I understand why seniors reach for them, especially after exercise or during hot weather. The messaging around hydration and electrolytes sounds responsible and health conscious. But what these products actually contain after 70 is a combination that puts serious strain on kidneys that are no longer equipped to handle it. Here is the biology. Most commercial sports drinks contain between 150 and 270 milligrams of sodium per bottle. They also contain potassium in concentrations that are problematic for aging kidneys. In a healthy 30-year-old, the kidneys regulate potassium levels with remarkable precision. But research published in the American Journal of Kidney Diseases found that after the age of 70, the kidney's ability to excrete excess potassium declines by approximately 40%. This condition, called hyperkalemia, where potassium builds up in the bloodstream faster than the kidneys can clear it, can cause dangerous and potentially fatal heart rhythm abnormalities. A 73-year-old patient came to me after developing palpitations and unusual fatigue. He was doing everything right in his mind, walking daily, staying hydrated, drinking 2 sports drinks a day because he had read they were good for active seniors. His potassium levels were dangerously elevated. We removed the sports drinks entirely and replaced them with plain water and a small amount of coconut water, which contains naturally occurring electrolytes at levels far lower and far more balanced than commercial formulations. Within 3 weeks, his potassium had normalized and his heart rhythm had stabilized. For proper hydration after 70, drink filtered water consistently throughout the day. Add a small pinch of sea salt and a squeeze of lemon if you need electrolyte support after physical activity. That simple combination provides what your body actually needs without the excessive potassium and sodium loads that aging kidneys cannot safely process. And if you are finding this information genuinely useful, this is a good moment to hit the subscribe button and like this video. Every week, I bring you evidence-based content specifically designed for people in their 60s, 70s, and beyond. Your support helps this information reach seniors who need it most. Number 3 is one that is going to surprise you because it involves a category of food that is universally considered virtuous. I am talking about high-protein shakes and protein supplements, specifically the whey-based and casein-based protein powders that have become enormously popular among seniors trying to prevent muscle loss. And let me be very clear, protein after 70 is essential. Sarcopenia, which is age-related muscle loss, is a genuine and serious threat to independence and quality of life. The instinct to increase protein intake is correct, But the form that protein takes matters enormously for kidney health, and most people are never told this. Here is the mechanism. When your body metabolizes protein, it produces nitrogen waste products, primarily urea and creatinine. These waste products must be filtered out of your blood by your kidneys. In a young person with full kidney capacity, processing a high-protein diet is manageable. But research from the National Institute of Diabetes and Digestive and Kidney Diseases found that in adults over 70, a high intake of concentrated protein supplements, defined as more than 40 grams of protein in a single serving, creates a filtration demand that exceeds what aging kidneys can efficiently handle. Over time, this chronic overload contributes to what nephrologists call hyperfiltration injury, where the kidneys are essentially damaged by being forced to work beyond their capacity repeatedly. A landmark study published in the American Journal of Clinical Nutrition followed 1,624 adults over the age of 65 for 5 years and found that those consuming high-dose protein supplements had a measurably faster rate of kidney function decline compared to those obtaining equivalent protein from whole food sources spread across the day. The solution is not to reduce protein. It is to distribute it intelligently and choose the right sources. Aim for 25 to 30 grams of high-quality protein per meal from whole food sources, eggs, fish, legumes, plain Greek yogurt, rather than concentrated supplements. If you do use a protein powder, choose a plant-based option like pea protein, which research from the Journal of Renal Nutrition has shown to be significantly gentler on kidney filtration than whey or casein. And always spread your intake across 3 meals rather than concentrating it in one large serving. Number 2. I promised you this one would surprise you, and I want you to hear every word of what I am about to say, because this is the food that I receive the most pushback on when I discuss it with patients. And the pushback always comes from the same place, which is disbelief, because this food has been considered a health food for so long that questioning it feels almost wrong. Number 2 is spinach and other high-oxalate leafy greens, specifically when consumed in large quantities, as has become popular through green smoothies and large raw salads. Before you close this video, let me explain exactly what the research says, because this is not a reason to avoid spinach entirely. It is a reason to understand a specific risk that nobody is telling seniors about. Spinach is extraordinarily high in oxalates. Oxalates are naturally occurring compounds found in many plants and in most healthy adults. With fully functioning kidneys, they are filtered out and excreted in urine without issue. But here is what changes after 70. As kidney filtration efficiency declines, the kidneys become less capable of clearing oxalates from the bloodstream efficiently. Excess oxalate binds with calcium in the kidneys and forms calcium oxalate crystals, which are the most common form of kidney stones and which in chronic cases cause a condition called oxalate nephropathy, where oxalate crystals accumulate in kidney tissue and cause direct structural damage. Research published in the Clinical Journal of the American Society of Nephrology found that high dietary oxalate intake in adults with even mildly reduced kidney function, which describes the majority of adults over 70, was associated with a significantly elevated risk of progressive kidney damage. A single large raw spinach smoothie can contain up to 900 milligrams of oxalate. The safe upper threshold recommended by kidney specialists for adults over 65 with any degree of reduced function is approximately 50 milligrams per day. This does not mean eliminating leafy greens. It means choosing lower oxalate alternatives like kale, bok choy, arugula, and romaine, which provide equivalent nutritional value with a fraction of the oxalate load. And when you do eat spinach, cooking it and discarding the cooking water removes up to 50% of its oxalate content, according to research from the Harvard School of Public Health. Pairing calcium-rich foods with any oxalate-containing meal also causes oxalate to bind in the gut rather than in the kidneys, dramatically reducing the amount that reaches the bloodstream. And now we have arrived at number 1, the single most dangerous food for kidney health after 70. And this is the one that I lose the most sleep over as a clinician because it is the food that is most deeply embedded in everyday senior life, the one that is marketed most aggressively as harmless, and the one whose kidney damaging mechanisms are most consistently overlooked by general practitioners. Number 1 is over-the-counter pain medications, specifically NSAIDs, which stands for non-steroidal anti-inflammatory drugs. Ibuprofen, which is sold as Advil and Motrin. Naproxen, which is sold as Aleve. And aspirin in regular doses. I classify these here because they are consumed as routinely as food by millions of seniors for arthritis, back pain, headaches, and general discomfort, often daily, often without any awareness of what they are doing to kidney tissue. Here is the exact mechanism. Your kidneys rely on specific compounds called prostaglandins to maintain healthy blood flow through the tiny vessels that supply kidney tissue. NSAIDs work by suppressing prostaglandin production throughout the body. That is how they reduce inflammation and pain. But in suppressing prostaglandins systemically, they also constrict the blood vessels feeding your kidneys. In a young person using these medications occasionally, the kidneys recover between doses. But research published in the British Medical Journal found that in adults over 65 who use NSAIDs regularly, meaning 3 or more times per week, kidney blood flow is chronically reduced, leading to a condition called analgesic nephropathy, a form of kidney damage caused directly by pain medication use. The same study found that regular NSAID use in adults over 65 was associated with a 58% higher risk of acute kidney injury during periods of mild dehydration, which, as we discussed, is extremely common in seniors who do not feel thirst the way younger adults do. The combination of chronic NSAID use and mild dehydration is one of the most common causes of sudden kidney function decline in older adults that I have encountered in clinical practice. The solution requires a conversation with your doctor. Do not simply stop a medication you have been prescribed without guidance, but bring this research to your next appointment. Ask about acetaminophen as an alternative for pain management, which is significantly gentler on kidneys when used at appropriate doses. Ask about topical anti-inflammatory creams, which achieve local pain relief with far lower systemic kidney exposure. Ask about physical therapy, gentle movement protocols, and anti-inflammatory dietary strategies that can reduce your dependence on oral pain medications entirely. Your kidneys cannot tell you they are in trouble until a significant amount of damage has already been done. There is no pain signal, no obvious symptom in the early and middle stages of decline. By the time most people discover their kidney function has dropped, they have lost ground that is very difficult to recover. That is why what you do today, the foods you choose, the medications you reconsider, the habits you change tonight, those decisions carry consequences that compound over months and years. But here is what I want you to carry with you after this video ends. Your body at 70, at 75, at 80 is not finished responding. Remove the things that are harming it, and it will begin to stabilize. Kidney function that has been stressed by poor dietary choices can partially recover when those stressors are removed. The research is clear on this. Your kidneys are resilient organs. They have filtered your blood millions of times over your lifetime. Give them what they need and reduce what is hurting them, and they will continue serving you. Start with one change from today's list. Replace the deli meat this week. Swap the sports drink for water with lemon. Talk to your doctor about the pain medication. These are not difficult changes. They are small decisions that add up to something that matters more than almost anything else, which is being here, being independent, being yourself for the years still ahead of you. If this video helped you, please share it with someone you love. A spouse, a sibling, a friend who reaches for ibuprofen every day without a second thought. You may be giving them a gift they did not know they needed. Subscribe to this channel if you have not already, because every single week we go this deep into the science of aging well. And leave me a comment right now. Which of these 5 surprised you most? And are you going to make any changes starting today? I read every single one. Take good care of yourselves. I will see you in the next video.